Good morning, and it's a great pleasure to be here with you. I'm going to go on to the next slide. What I'm going to do is talk about climate change in relationship to physical health pathways and health outcomes, and explore the multi-level vulnerability of indicators that change susceptibility, adverse outcomes, and different kinds of health effects. And then my colleague Gary Evans is going to talk more about the behavioral health implications. What you see here is the, again, back to our model, and JR's talked about the exposures. I'm going to talk about both the susceptibility and adaptation responses that will take place, both in terms of the susceptibility that individuals have and also the susceptibility that different kinds of environmental and social conditions impart on in terms of the context. And part of what we're looking at really is this issue of vulnerability, which is the sum of risk and protective factors that determine adverse or positive health outcomes. And this is related to the sensitivity, the susceptibility, and the inherent resilience that individuals have. And again, resilience is a quality or a response pattern that varies both by age and location of where people live. When we think about it from a life course perspective, what we understand is that there are different factors that go into making someone vulnerable in terms of the kinds of factors that impact them. There's the biological sensitivity that people face that has to do with developmental stage in their development, which it also has to do with any kind of pre-existing medical conditions or medication use that individuals have, other kinds of acquired factors in terms of their inherent or changes in their immunity, as well as other kinds of metabolic issues that have to do inherently in individuals. Then there are health system factors that have to do with, do you have access to health care? What kind of health care do you have access to? And other kinds of potential preventive measures. And then the contextual factors, which have to do with the socioeconomic status, the likelihood of exposures to stressors based on occupation and living conditions and specific neighborhood conditions. So all of these are factors that go into considering who's vulnerable and who and the level of vulnerability that people have. And one of the things that I need to point out as a pediatrician is that this varies across the lifespan. And for children in particular, they have enhanced vulnerability just by the nature of being a child, because their small body mass and surface area, they're, in terms of thermal regulation, it's much more difficult for them, especially for young children or babies, to adapt to different changes in temperature. And you see here a whole set of other factors that have to do with their physiology and sort of where children play and live and grow and develop, so that all of those are impacts on how they will respond and the nature of their resiliency. In ways of thinking about and mapping vulnerability to climate change, comes from Pacific Institute up in Northern California. Part of what they began to look at is a whole set of living conditions and social factors that potentially would make individuals vulnerable to different kinds of effects. And I show this because what they did is they put together an index of vulnerability that could potentially be then looked at in relationship to changes. And here in these maps, which are similar to the ones that the Luskin Center produced, what we see is the high vulnerability areas are basically the same overlapping areas. This is based on their index, and then just zoom in on some of the areas in the valley. You see that there's certain specific areas where you're going to have very high vulnerability of individuals in those areas. And those, again, from a mitigation or prevention standpoint, those are areas that we need to pay particular attention to as things move forward, if in fact we're going to try to decouple the effects of climate change on individual and population health. So when we think about temperature and extreme heat, and as JR showed, that we're going to see these big changes that happen and they're not evenly distributed, we have a whole variety of factors that impact on how people respond to those changes in temperature. Existing medical conditions are a big factor that plays a role. The kind of medications that people take, because certain kinds of medications change the way that your body's actually able to adapt to temperature change, the use of alcohol and other kinds of drugs, the amount of exercise that people do and get, and the age and race and ethnicity are all factors that are going to mediate the response. What we also see is that there are a whole set of other factors that take place, and again, looking at children, we see these factors, as I mentioned, but also here I've added pregnant women, and from a study recently done that on temperature issues and impact on pregnant women in terms of birth outcomes. That has to do with the changes during pregnancy and bodily demands and greater need for thermal regulation, so the pregnant women are particularly sensitive to changes. Those are other factors that need to be looked at. And then there are a whole set of other contextual factors, again, in terms of the living conditions. People living on the top floors of certain buildings are going to have more exposure. People living in cramped quarters, that again, the conditions of the neighborhood in terms of the density and vegetation, the forest cover, and other factors all play a role in terms of temperature and heat susceptibility to different kinds of health outcomes. And so that when we look at the temperature and extreme heat related mortality that we've outlined in the report, the kinds of things you see are heat exhaustion, heat cramps, heat stroke, and death, as we've seen around the country during the sort of heat waves that took place in Chicago a few years ago, and especially for individuals in poor communities that were living in single room occupancy areas with no air conditioning. There was very high mortality rates. See exacerbations of pre-existing conditions, especially those that have to do with cardiovascular function and thermal regulation. We'll see increased load on our healthcare system in terms of ER use and hospital admissions. And then again, for women and pregnant women, we know that there's a higher rates of preeclampsia, premature births, low birth weight babies that are all tied to changes in temperature. When we look at precipitation, although precipitation is not scheduled, overall precipitation isn't going to change all that much. There are several other factors that we need to think about, because that people with chronic health conditions, that the levels of precipitation actually have a big role to play in terms of allergens in individuals with asthma. And having to do with the amount of vegetation and the amount of pollen that is in the air. There are also other contextual factors that have to do with the runoff water that has to do with certain kinds of infectious diseases. And what we see is with changes in precipitation, and there are changes in waterborne diseases due to basically different types of parasitic infections that end up contaminating water due to increased water runoff and sewage, as well as on the other side with the desertification or lack of water during times. You see higher rates of Salmonella and E. coli infections because the fact that farmers are trying to save water, are actually using water for irrigation purposes that they shouldn't be using in order to irrigate their crops. Again, this just highlights the complexity of the issues so that it can go one way or another, and the multiple factors that are influencing health outcomes. It also points to the kinds of surveillance systems that one needs to have in place to understand changes that are taking place in terms of disease burden and the like. And then lastly, issues that have to do with air pollution and wildfire. Again, the children have unique sort of vulnerability issues in terms of their exposures, and both prenatally and in early life, the amount of time they spend outdoors, and their lung function in relationship to changes in air pollution and wildfire events. And what we see here, what we can expect is increased ozone and smog forms in the atmosphere, and obvious breathing associated problems that have to do with inflammation of the lungs, increased risk of asthma, the long-term effects on lung function over time, which, you know, for someone who was born and raised in Los Angeles and remembers being in elementary school and smog days here and sort of seeing our air quality get so much better, just the thought that it's going to go in the other direction, you know, is not something that I'm looking forward to. There are also the increased particulate matter that comes from wildfires, and that it's really the particulate matter that probably forms the most salient and important risk to health, and especially in respiratory function, but increasingly in terms of cardiovascular function. And again, just highlighting the risk to pregnant women, and a number of studies that have been done recently showing just with our air pollution and how close women live to freeways at present has a lot to do with prematurity rates. Again, these are risks and outcomes that we can expect to see moving forward. Doesn't mean that they will happen. There are things that we can do to mitigate many of these, but that's part of the challenge now for the health and public health community, as well as the wider community. These are not just medical care issues or public health issues, but they're going to be issues for the entire region, and cross sectors coming together to figure out how we mitigate against these likely outcomes.